welcome everyone to this interesting session, which is Accelerating Recovery After Stroke with Integrative Care by Dr. Rakesh Nair. So I would like to begin this session by introducing about our organization, introducing about Dr. Rakesh, as well as the importance of World Stroke Day, which is today. So I will be talking a little bit about that. I am Dr. Priyanka from Apollo AyurVAID, and I want to start with I would like to start with our organization's introduction. So Apollo AyurVAID, it is a chain of Ayurveda hospitals, leader in quality systems driven Ayurveda medical care that focuses on the root cause diagnosis and management of serious chronic conditions, diseases. It was founded in 2005 and we've treated over 350,000 patients to date, employing an end-to-end protocols-driven classical Ayurveda approach to address a diverse range of healthcare needs. We cover medical specialties ranging from neurology, orthopedics, and metabolic disorders to respiratory issues, gynecology, pediatrics, dermatology, and beyond. Our approach seamlessly integrates the time-tested practices of classical Ayurveda Chikitsa, that is medical management, with contemporary medical methodologies, ensuring the delivery of well-aligned and effective medical interventions. Currently, Apollo AyurVAID operates in Bangalore, New Delhi, Gurgaon, Chennai, Kochi, and Almora with 12 operational centers. Excellent facilities at Apollo AyurVAID are complemented by an exceptional team of experienced, highly qualified physicians and Ayurveda nurses trained in accordance with NABH standards. Our team includes MD Ayurveda qualified physicians from leading institutions of higher learning in Ayurveda. As we all know, today is World Stroke Day. World Stroke Day is observed annually on 29th October to raise awareness about stroke, its prevention, and the importance of early intervention. It serves as a global platform for educating people about the risk factors associated with strokes and the measures to reduce its impact of this life-threatening condition. As World Stroke Day, today we are talking about Ayurveda, how Ayurveda highlights the potential of integrative care in preventing and managing stroke-related conditions. On this note, we have today with us Dr. Rakesh Nair, Senior Physician at AyurVAID Hospitals at Aster CMI, Bangalore. Dr. Rakesh has over 14 years of vast clinical experience and expertise in integrative management of subacute neurological conditions. He specializes in neurodegenerative conditions as well and certain life-threatening conditions like stroke, such as and also road traffic accidents, that is RTA, Parkinson's disease, multiple sclerosis, chronic pain management, and spinal disorders. Dr. Rakesh is actively heading the neuro-rehab program at Apollo AyurVAID. Dr. Rakesh, I welcome you to this webinar, to this session, and over to you for your guidance. You're not audible.
Okay, yeah, thanks. So thank you, Dr. Priyanka. Thank you. Good morning, dear viewers. One second, I'll just share my screen. Is it visible, Dr. Priyanka? Hello?
Yes, it's visible. Yes.
It's visible, right?
Yes.
Okay.
Go ahead.
I'm audible also, right?
Yes, sir.
Thank you. Thank you. So, good morning, dear viewers. So today being World Stroke Day, I am here to give some informations on stroke and how faster we can get the patient to recover with the integrative care module. So prior to understand what's the integrative care model, we have to understand what is stroke. So, a stroke, sometimes called as a brain attack, when something blocks the blood supply to part of the brain, or when a blood vessel in the brain bursts. In either case, part of the brain becomes damaged or dies. So, we have to understand that stroke is the leading cause of disability worldwide and the second leading cause of death. There is an study stating that 1 out of 4 people is estimated to have a stroke in their lifetime, which is a 50% increase over the last 17 years. So there is a lifetime risk. So we as a general public should be alert and aware on what is a stroke, what is the signs of stroke, what are the treatment modalities, etc. So thank I take this opportunity to give this information. So basically, to understand the types of stroke, there are 3 types of stroke. One is we called as the ischemic stroke. The ischemic stroke is basically caused due to the occlusion of blood vessels to the brain. The brain cannot get sufficient oxygen or nutrients from the blood, and without oxygen and nutrients, the cells die within minutes. This condition is called as ischemic stroke. The second type of stroke, where the rupture of blood vessels to the brain, which is called as hemorrhagic stroke. The leaked blood results in pressure on the brain cells, which damages, which is called as hemorrhagic stroke. And the third type is a transient ischemic attack, or what we call it as a mini stroke. The stroke, which lasts for few minutes, occurs when the blood supply to part of the brain is briefly interrupted. So, knowing the type of the strokes knowing the type of strokes, we have to next understand what are the signs of strokes. So, to understand the signs of stroke, there is a code word: be fast. B stands for loss of balance, headache, giddiness, eyes, eye movements, blurred vision, or trouble seeing in either eyes or both the eyes, trouble breathing. For face, F stands for face. There is one side deviation, face drooping, arms, weakness in your arms, the legs, or inability to lift, speech difficulties, or unable to pronounce words. T is the time to call. Time to call whom? Time to call the ambulance to reach or to make the patient available to the nearest equipped hospitals which has all the modalities. Just like an heart attack, there are hospitals which is neuro resuscitation team, which means stroke resuscitation team. They are equipped from end to end. So you have to take the patient to the nearest hospital so that the modalities or the treatment can be initiated as early as possible for early recovery. So, to understand what are the treatment options, the medications and the treatments vary on which type of stroke, the position of the stroke, the person, its comorbidities, etc. etc. There are concerned experts who can take care of this, but broadly, the treatments are divided into 3 types, which is first is the medications. Medications comes under the classification of thrombolytic drugs, that is to be administered within minutes to 4 hours. Second option, based on the type of the stroke, surgery, where a well-equipped neurosurgeons operate on the clogged sites and then remove. It could be embolization, it could be DSA procedures, etc. But reaching the patient to that equipped hospital is the key. And finally, the rehabilitation. The hospital also should be equipped with the rehabilitation. However, amongst all the type of strokes, blood pressure management, which is a very crucial strategy or where it becomes a very key part in handling the stroke. Either it's ischemic, which is blocked, or hemorrhagic, which is bleeding. So knowing about this type of strokes, the signs of strokes, and what are the treatment options, the viewers would be thinking, does Ayurveda explains about stroke? Does this have any reference of stroke? What are the references? Yes, Ayurveda also explains stroke in the name called Pakshagata. We would have known the colloquial terms like Lakwa, Pakshagadam, Pakshavadam, etc. So these are the local terms, but in Sanskrit, it is defined under the coined term of disease called Pakshagata, where it means it's one sided paralysis or weakness. This is identified as one of the 80 Nanatmaja Vata Vyadhi. Nanatmaja Vata Vyadhi means pure Vata increment. The Vata here is one of the humours as per Ayurveda doctrines. One of the beautiful message or the quote, this one told by the doctrines is the Udbhavasthana. The Udbhavasthana means the origin of the stroke as per Ayurveda is Pakvashaya, which is the gut. You may be surprised because symptoms are happening in the brains, but the classical principles are saying about the gut. Please keep this on hold because in further slides you will appreciate what is the logic behind that. And moreover, there are some signs and symptoms told both in Charaka Samhita and Sushruta Samhita on strokes. So, knowing about the references of strokes and the treatment principles of strokes, there is a requirement of what we call it as an integrative medicines. What is the reason for the integrative medicines? These complex conditions such as neurodegenerative diseases or neurological conditions such as stroke requires a multifaceted teams of expertise to treat because the conditions are like that. So basically to get you into that, we have to understand what are the basic foundation principles of integrative medicines. To understand the foundation principles of integrative medicines, first thing we have to understand is it neither rejects the conventional system of medicine, but it doesn't accept any alternative therapies uncritically. It is based on what we call as a good science, which is inquiry driven and open to new paradigms. The whole concept of integrative treatment or the concept of treatment is broader. That is, it's not only disease specific, it is health promotion, it is to prevent the illness of any paramount. So these are the basic foundational principles of what we call as an integrative medicine. Then, what is the need for the integrative approach? There is a reference in Ashtanga Hridaya written by Acharya Vagbhatha which says, Prayogaha shamayed vyadi mekam yo anyam udirayet na asau vishuddhaha shuddhastu shamayedhyo na kopayet, which means he says any therapy of any origin which specifies the vyadi or the disease or the symptoms but gives rise to any other symptoms is not a pure therapy. The ideal or the pure therapy is one that pacifies without manifestation into other problems. This is the whole objective or the aim for an integrative approach. Then the reason would be that why there is an integrative approach, why not the conventional system of medicine take care, or why not the conventional PMR, what we call as the physical medicine and rehabilitation team take care, because there are physiological barriers for recovery, especially in stroke cases. What are those? Some barriers would be secondary mental morbidities. A stroke patient undergoes a secondary mental morbidities such as agitation, aggressions, fatigue, anxiety, depressions. They also may undergo an impeded blood-brain barrier dysfunction. There is also an associated comorbidities seen prevalently in all neurological cases, especially in strokes, such as loss of taste, loss of smell, constipation, behavioral disorders. Then secondary complications because of neuroinflammations caused in accelerated apoptosis. Then this leads to the progression of damages for the neural cells, what we call as the cascading effect. So these are some of the physiological barriers for cutting down the recoveries. For that, it needs to fill the gap. That is being jointly done by this integrative model. So once we know the what is the physical barriers on the recovery, there is an complete objective. What is the objective? The objective would be that there is an holistic assessment and evaluation of the residual impairment. A patient who has undergone stroke, post stroke, there may be some residual impairment. Second, functional limitations, how much he is limited for his daily activity, his participational disability. Third, we can also have an assessment on disease etiogenesis, from where it has started, how is the prognosis, how is this recovery. Addition to that, the whole person healing, that is the functional parameters, functional rehabilitations, quality of life, the symptom elevation. So these are the variety of the objectives, what we can evaluate, or and what we can give offer for the integrative stroke program. So how is it done? We call it as an assessment. The first step at AyurVAID is we understand the presenting complaints, severity, period, or latency of symptoms and identify, we call it as primary Vedana or the Pradhana Vedana. Once it is understood, a complete understanding of the functional health parameters such as the sleep, the bowel and bladder, the state of mind, the appetite, the circadian rhythm, the pain, etc. is being assessed. Followed by that, we go a rigorous process of Rogi Pariksha. What are the steps of Rogi Pariksha? Ayurveda advocates a Pariksha of Rogi in two folds. One is Ashtavida Pariksha and the second one is a Dashavida Pariksha. Ashtavida Pariksha means eightfold primary examinations, which includes Nadi, Mala, Mutra, Jiva, Shabda, Sparsha, Drik, and Akriti. These are viable parameters for assessment. Now, the question may arise that the patient may be in bedridden. How can they inform? How can we understand the parameters? There, we do a thorough clinical neurological examinations and what possible parikshas, both Ashtavida and Dashavida. Plus, we ask the brief medical history from the patient's next kith and kin and understand what was his lifestyle, what was his habits, what was his other parameters, and come to an understanding for the path of evaluation. Second part is the Dashavida Pariksha, which is the tenfold examination, which has various parameters. But this is very crucial to be done as a part of a examination because one, it assesses Rogi Bala. What we say is that the strength or the endurance of the patient, both physically and mentally. Second, it also gives us the idea of Roga Bala, that is, what is the intensity or the severity of the disease. Third, it also gives us an idea on Ayu Bala, that is, what is the quantity and quality of the lifespan. By doing this Ashtavida and Dashavida Pariksha, the Rogi Pariksha is done. So we have the primary Vedana, we assess the functional health parameters, and we go for Rogi Pariksha. This is a process which on a detailed assessment at AyurVAID we do. At the end, it helps us, the Vaidyas, to understand a comprehensive treatment protocol, which would include one, which are the body components which is affected first. Second, helps us in planning about the diet and the lifestyle. Third, it helps us to understand the nature of morbidity, the components, tissues, the organs, what has been affected, and further what can be affected, what we consider or what we call it as Samprapti. The Samprapti is an etiopathogenesis tree which helps us understand the root from where it is started and how can it proceed further. Then the treatment will intend to reverse this Samprapti or Samprapti Vigatana, we say. Fourth, it understands the vigor of the disease and makes us give us a effective treatment blueprint, which is customized as per the data collected. So based on this, the whole summarization can be on this following stages. That is the Roga Avastha. Roga Avastha means at what stage is the disease manifested. Stroke has occurred, but after the stroke occurring, which stage of the stroke is he progressing into? What is the dosha gati as per Ayurveda standards? Dosha gati here is there are two types of doshas or the humors, which is Sharirika and Manasika. The Sharirika dosha is Vayu, Pitta, and Kabam, and Manasika doshas is Rajas and Tamas. What are their present status? Where are they moving? What is the variance? This gives a complete assessment. The Sroto Dushti Prakaranam. Srotas are bodily channels. What bodily channels are being affected? which helps in symptoms identifying. Second, it also helps us in assessing autonomic nervous system activities, the sensory motor pathways, etc. And many other assessments can be understood. There, what are the Dushti Prakaranam or what are this been affected. Fourth, what is the status of the patient's Dhatu Agni Ama? That means what is the metabolic state of the patient, which helps us to understand the tissue nourishment, the metabolic impairments, the reduced deficient nutrition or reduced blood flow, the energy levels, etc. These are the parameters which makes us to assess on Dhatu Agni Ama. Finally, it gives us the understanding, or it makes us understand that what is the implications of the disease and the patient in expecting the prognosis, which is sadhya or asadhya. These are the viability, or these are the chains, or these are the trademarks on which a proper assessment of a stroke patients can be done, has to be done. Once this is done, it gives us a understanding or a derivation of the as a personalized health plan to plan what has to be done. So once we have assessed, the question arises is what happens during integrative rehab. So when a patient is finishing his acute management, that is under the neurosurgical expertise, they are forwarded, or they are being referred to the PMR department, or what we call as the physical medicine rehabilitation team, where they have their goals, where they have their objectives. It could be different modalities such as hyperbaric oxygen or tilt bar or any swallowing therapies or occupational therapies, etc. But what is the add-on things when Ayurveda is being added, or what is the need for an integrative rehab? With this existing goals, there are other goals which needs to be achieved, such as we have to restore the gut microbiome of the patient, number one. Second, we'll have to regulate the circadian rhythm of the patient. We'll have to reduce the oxidative stress, promote cognitive healing, improve functional health parameters, control the progressive chronic inflammations, maintain the lung hygiene and ventilation. So these are all the other parameters which needs to be assessed along with the existing rehabilitation. So once this is done, the second question would be how it's done. It's usually done in this format, that is, when there is an existing rehab undergoing, there is also a parallel therapies. I repeat, or I clarify that there is a parallel sessions of Ayurveda interventions also going in the form of ahara, that is the diet, in the form of vihara, which is the lifestyle changes, aushadas, which is external medications, and some kriyas or therapies. The conjoint or the amalgamation of both the system of medicines is the actual integrative rehab. What is the treatment sequel? So the treatment sequel is followed by what we call it as, after understanding the disease condition, the patient endurance, the patient strength, we plan a plan-based Ayurveda generic medicines with a personalized diet. The therapist is usually focused on two factors, which is Shamana or Shanti. The Vaidya takes a call whether uh, we start with Shamana or the Shanti. Shamana means localized treatment, either to improve the spasticity, to facilitate tone, to restore muscle strength, etc. Or go for a Shanti approach, that is a systemic correction leading to reduce inflammations or improve metabolisms, or both. It is a Vaidya's logic. This is done through three steps. The three steps would be Purva Karma, which is the preparatory therapies. The preparatory therapies would be local therapies, external therapies, or the whole body therapies. The second would be the Pradhana karmas, or the main deep whole system cleansing. It could be in the form of medicated enemas, it could be any other main external therapies, etc., which is called as the Pradhana or the main treatments. Followed by which is the recuperative three therapies, or the Brahmana therapies, we say, which is to stabilize or to strengthen the systems. Finally, we have what we call it as the Rasayanam, or the nourishing therapies, the strengthening therapies, for further prevention or alleviation of risk factors of stroke. So this is the sequel what at Ayurveda we follow. So the question is, what can a stroke patient expect through an integrative approach? One, higher mental functions. That is, he can be expected for an early restoration of conscious, alertness, cognition. Second, increased parasympathetic and sympathetic activity. That is, to improve his metabolism, digestion, nutrition status, muscle health, prevent second degree complications such as atrophy. Third, sensory motor functions, which is to normalize the muscle tone, improve endurance, compliance to rehab, promote mind well-being. These are all the objectives. Fourth, the oromotor system, that is for swallowing, for slurry of speech, improve comprehension of speech, chewing abilities. Fifth is the bowel and bladder, regulate the bowels, regulate the bladders, reduce constipation, weans catheters, improve the gut microorganisms, the ecosystems. So these are all the multifaceted objectives a stroke patient can expect through our integrative approach. When this has to be done, the question is what time. So there is something called as a golden period of recovery. That means the accelerated recovery and the best outcomes are expected in a stroke patients, which is more prominent during the golden period of recovery, which is few weeks up to 3 months following the episode of stroke. So during this golden period of recovery, there is a greater chance for a patient to recoup or bring back to his daily life. So the question arises is that is it practically possible, whether this has been done, whether the integrative care is happening, or whether integrative care is it creating a positive outcomes. I would like to share a video of one of our patient who is 50-year-old plus having hemiplegia and his road to recovery in the golden period with an integrative management. So on October 16th, 2022, Dr. Priyanka, is this visible, right?
Yes, yes, visible, sir.
Yeah, thank you. So on October 16th, 2022, he was tracheostomized, catheterized, and his GCS control was 4, where our therapies had started. One day, in 1 week, his GCS scale has gone to 6. The next day, movement of the leg. The first movement of his left hand post stroke. So in 1 month, where he was tracheostomized, in 1 month, he is now able, which was a gastric feed, we were able to achieve to give his food orally. So in span of 1 month, exactly precisely 32 days, his GCS scale has improved to 12, which was 4, has come to 12. So these are the, at Ayurveda, we keep a track on the prognosis with international outcome measures. So with this gentleman, we had this outcome measures. There are other outcome measures that we keep a track on, such as Chedok McMaster scales, Morse fall risk assessment, etc., etc. So based on the conditions, so that is been periodically being assessed to understand what is this improvement. So from the timeline of 15th November, October to December, you see his quality of life has been improved, where at present he's doing his daily activities independently with minimal support, very minimal support. So that is the positive outcome of golden period of recovery. Now the question may arise that, what we have missed the golden period of recovery. There rise the principles that even the golden period of recovery is missed. Their principles is laid to get the recovery, but only thing is, in golden period of recovery the acceleration is higher. So the concept is that, from the integrative point of view, is the complementary therapies uncritical, or do they have a logic, or do they have any outcomes, or do they have any um, um, references for this? There are few articles and studies done worldwide. One of them is the gut microbiome brain axis, where there the gut is considered as the second brain, or the enteric system is called as the second brain. There is a constant communication of the gut to the brain via three ways. That is, the first one is via the blood, the immune cells. The second one is via the vagus nerve axis. The third is through the systemically circulating bacterial metabolites released by the intestinal microbiota. Why is this crucial? This is crucial because stroke usually leads to intestinal dysmotility and leakiness of the intestinal barrier, which is associated with the change of gut microbiota composition and interaction of human host. This is the study done, and then it is understood that without treating the gut, the acceleration of recovery is bad. It is for this principle that ages ago, few thousands, during the thousands, our Samhitas have told the Udbhavasthana, or the origin of Pakshagata, is Pakwashaya, which is the gut. So there's a direct correlation that healthy gut helps in healthy recovery. It also states that persons who have undergone probiotics or a microbiota targeted therapies for post-stroke recovery, there is an accelerated or a very faster recovery than patients who has not undergone a probiotic. They go undergo what you call as a permanent disability or residual disability. This is valid even for all neurodegenerative conditions, all neurological conditions. And once we stabilize the gut, or once we improve the gut microbiota through our therapies, through our external therapies, through our internal therapies, through our changed diet, and through our verified or changed lifestyle, we see that the gut microbiome is enhanced, which helps in healing the stroke, which also maintains what we call as neuroendocrine homeostasis, because secondary problems or other issues post stroke, which could be immune related or autonomic nervous related, or pain related or psychological disorders, the neuronal messages, the endocrine messages, the immune messages, these are all being stabilized, controlled through the Ayurveda approach of the gut microbe axis. So with this gives us the information that the integrative care is an add-on with the conventional care. Plus, it helps in accelerated recovery and brings back the patients who's undergone stroke to a faster quality of life, to his daily activities. So I end my presentation here. I'm open to the questions.
Thank you so much, Dr. Rakesh. This was really very informative, and it really explained how integrative care is the need of the hour for stroke patients, especially when it comes to the golden period of recovery. So I would like to start the question and answer session by asking a question first. You spoke about the golden period of recovery, and there is a concept also in the US which is called step down care. So, can you talk about what stages of stroke can Ayurveda help, and what exactly is this step down care?
So, yeah, there are two options. There are two parts in that. First, a step down care. A step down care relatively means a considerable lower level of care for those who are stepping down from a critical care in acute hospitals. Like this, when the patient undergoes an acute attack, he may be put into an ICU or in critical care for a close monitoring. Post that, he comes down to a ward level, which we consider as a step down care, which is a lateral transition of care from a recovery area for post operative. This care is of key focus, and key care, and it focus mainly on rehabilitation and recovery of the patient back to his or her maximum functional status. From there only the rehabilitation starts. Now, the second part of the question is, at what stages of stroke with the Ayurveda can help? Usually, recovery after a stroke is believed to be most successful during the first 6 months, following an acute medical or a surgical care, or following a life saving surgical care, alongside the modern rehab modalities. Along with that, even Ayurveda therapies or Ayurvedic interventions also can start. We can start. We have also observed, we at AstraCMI, we have also observed sensitivity to Ayurvedic interventions alongside modern rehab therapy to be well complemented during the golden recovery period. However, the efforts are well complemented in chronic stroke of survivors too, because our modality or our approach is the gut-brain axis, which is proven to engage cognitive stimulation and improve sensitivity to recover cycle sensitivity post even 6 months.
Right. Thank you for answering my question, Dr. Rakesh. Can we take more questions from the participants?
Sure.
Okay, so there is a question from Dr. Uday Ganesh. How to differentiate between ischemic and hemorrhagic stroke clinically without any scans?
Right. So, from the Ayurveda parameters, if an ischemic stroke is there, there will be weakness, number one. Second, immobility, inability to raise legs. In hemorrhagic stroke, there will be associated loss of consciousness. It's a conscious level. In hemorrhagic stroke is an acute stroke where the patient's conscious is lost immediately. He may recover faster, but his conscious is lost. So it's based on this conscious level that we can assess it, is it hemorrhagic or ischemic.
Right, all right, sir. I hope this cleared your doubt, Dr. Ganeshji. Another question is, what is your prescription after treatment for maintenance of health after stroke so that it doesn't reoccur?
So depends on the rehab, the process of rehab actually. So if the rehab goes well, that is, his residue symptoms are taken care, both physically, mentally, his functional health parameters is improved, his energy levels are improved, he's able to do his daily activities of life, then the concept of rasayanam from our side or from our science can be well implemented. It could be in the form of gridam, it could be in the form of rasayanam, it could be a form of therapies, rasayana therapies. So based on the condition and based on how the patient recovers post rehabilitation, during the course of after rehabilitation, that's where we have to reassess, and of course there are checklists for this. So there is an international outcomes checklist on type of strokes and the symptoms. If the checklist is being cleared, then we take a call that we have to go for rasayanam to prevent further strokes.
Right. Thank you, sir. Another question. What are the main advantages that Ayurveda offers that complements modern medical approaches in the stroke recovery?
One is, I would say, system focus, focus systemically, systemic focus. It promotes healing of the affected nerve cells. It also, we also help the patient improve their functional health parameters, such as their metabolism, the solid excretion, the catheterizations. Their cognition is improved, that is their alertness. We facilitate their alertness, we facilitate their cognitions, their motor relearnings, etc., etc. Help the PMR team for more neuroplasticity. These are all the things are the advantage that Ayurveda can offer, which can complement the conventional systems.
All right, sir. Thank you. By another question is, what any group of patients put into preventive care for observational studies?
Sorry. I,
Question is This question is from the audience participants. Is there any group of patients to be put into preventive care for observational studies? Is it something that we have done? Is what they're asking, I
no,
guess.
no, no, no. See, we are planning to do that, but still now we have not done that. For observational studies, we have not done that. But in future, we may be planning that.
Sure. Okay. As we spoke about the gut microbiome, there's another question on it. To improve gut, Basti karma is good or Virechan karma is good?
So it is not on the modalities. As I said, all our therapies, both external and internal, has effect on the gut microbe. It need not be internal therapies. Even the external therapies, a simple talam that is put in the medicated powder to your head, also has an effect on the gut microbe. There are studies and there is an implications. It is not on virechana or vasti. It is on the process of evaluation, the assessment, the rogi bala, the roga bala. If the rogi bala is weak, let's say he's bedridden, he's weak, we can't do virechana. Vasti as intended, we can't do, but we'll have to take. So the modalities change as per the condition. Yes, to answer the question, both the kriya karmas as an effect on the gut. But how do we choose it? What do we choose based on the assessments of our parameters plus the patient strength matters a lot.
Right. Thank you for answering that. Another question is, after how many days of surgery, Ayurvedic treatment, external and internal, can be started? And please mention the therapies and medicines given.
So surgeries are varied. Like they have craniotomy, they have embolization, they have DSAs, they have anerectomy, etc., etc., etc. The There is no fixed period that when it will start. But post surgery, when they do a step down care, that is when they shift to the ward. That is the area time that we can do a rehabilitation. Number one. Second, what all therapies based, again the question is like it is just generalized, but I'd like to answer that based on rogi bala or the patient strength. He may be bedridden, especially post surgery. He'll be bedridden, he'll be tracheostomized, he'll have multiple tubes, etc. So based on his conditions, we have to start rehabilitating from the bedside. Then the next level. So it is on using the yukti and the principles, the siddhantam of Ayurveda, that you see when you start applying to the patients. The recovery you see on a day-to-day basis, not on weeks. It's on day-to-day basis. You see the improvements. It could be dosha assessment, it could be srotas assessment, it could be the sampraptis, which samprapti gataka assessment. It could be multiple, but you'll see somewhere some improvements from the time you start from the bedside. So, what modalities you use based on the yukti of the Vaidyas? I could start from simple lay pumps, or it could be keys, it could be etc. etc. based on the condition and the type of the strokes.
Right. I do see that some participants are stroke survivors. Some of them have got some are posting their own cases as such. So I would request everyone who are posting their personal cases to opt for a personalized consultation. If you ask your questions like this here, These might not be the, you might not get a satisfactory answer, but when you consult with a doctor, they can understand your health history, they can talk about your stroke recovery very well, and you will get a better satisfactory answer when you speak with a doctor in one-on-one consultations, and that would definitely be helpful for you as well. Apart from that, if you have any questions related to the session related to stroke, Dr. Rakesh would definitely be answering that. So there's another question. Family members and caregivers are also involved along with the patient when it comes to being a stroke survivor. So, what steps can family members and caregivers take to incorporate some Ayurveda principles in their daily routines of the patients? Any specific practices that you would recommend?
So for stroke survivors, daily practices. So there is a concept of dinacharyam in the form of ahara. So what time he wakes up, what type of food he eats, based on his digestion, assessment of his digestions. It is not generalized. Basically, what I'm trying to tell is it can't be generalized. It varies from one person to another person. Like my digestion is not the same as the other person's digestion, so the food can vary from one person to another person. But however, the basic the routine of him, of the patient, that is from time he gets up, what's his digestion capacity, what's his energy levels, how was his sleep, how was his solid excretion, how was his liquid excretion, the whole functional health parameters on day to day basis, that is to be assessed. Which is the patient bystanders has to understand that what is his aggravating factors, what food can be aggravators, what food can be is helpful for him. Because some persons, on if you notice on day to day basis, develop, say I have eaten this, I developed acidity, I ate this, I developed constipation, I couldn't sleep because of my food yesterday. So there are multiple things happens like that. So not encroach into that type of food, a simple food based on his digestion, improve his lifestyle changes, and do yourself at home, which are vaidyas can help. Like for example, in our dinacharya there is a concept called abhyangam, which says abhyangam acharet nityam shira shravana padeshu. That means you have to apply oil and take bath on a daily basis. Especially if you can't apply with the whole body, at least apply for the shiras, shravana, pada, that is the ears and the hands. So like that, some amount of day to day small therapies which you can do yourself. Then mind, which plays a major role, and good environment, like doing some exercises, which also helps in the dopamine increases and good hormone secretions. So these are all the steps, but definitely it has to be customized as per the patient's needs.
Sure, sir. Another question is to reduce increased muscle tone, whether oil massage is advisable. Modern doctors or physiotherapists usually object massage.
Sir, the Abhyangam, or I don't say massage, first of all. The thing is, I don't consider, Ayurveda treatments in massages. I say it as an Abhyangam. Massage is different and Abhyangam is different. So if you're saying as an Abhyangam is a treatment procedure, right? Abhyangam, there is a condition where we have to do Abhyangam. It's not done randomly. For example, when we assess AMAM or a systemic inflammation in the system, and you have the digestion, that is Agni, which is very bad. So Agni, it can increase Agni. When Amam or the inflammation is there, Abhyangam is contraindicated. You should not touch the oil. Irrespective of stroke or any other diseases, when you have a systemic inflammation, oil should not be touched. So again, I would stress that the Vaidya's assessment on the patient's status, the health status, is very crucial to take a treatment plan. If it could be from simple abhyangam to a simple application of paste, because there are multiple factors which has to be kept in mind. Answering the point, in a non-inflammatory state, when I find out that the amam or the dysbiosis is get cleared, and when there is the need for the muscle to grow at that particular stage of the diseases, only abhyangam is prescribed.
Right, right. So another question, it is from me. So one of the challenges that a patient faces in a stroke recovery is probably secondary complications. So how can Ayurveda principles or Ayurveda integrative stroke rehab help in addressing these issues?
So, see, right from day one, our treatment protocols is towards managing stroke patient, which involves preventing the secondary complications. This is the key in accelerating the entire recovery process. So, if the assessment goes well, if the proper evaluation takes place, if the proper assessment of dosha, dhatus, the agni, the srotas, the samprapti, from an Ayurveda perspective, I'm trying to tell you that if the proper assessment and evaluation is done, then there is no secondary complications. If that is not done, then only there is a chance of secondary complications. Now that the secondary complications is already onset, then we'll have to revisit and reassessing it's gone wrong somewhere and proceed for further therapies. That is the only answer.
Thank you, doctor. Is there is another question? People are asking the stepwise modalities adopted in stroke patients through Ayurveda. So many people are asking the step-by-step procedures, what we do, and after discharge, what can be advised. So
So the I would like to clarify here that the treatment modalities for a ischemic stroke, the treatment modalities for an hemorrhagic stroke, or the treatment modalities for a transient ischemic stroke is different. Not from the this division, even from the treatment modalities of say let's say ischemic stroke. If there is an association of kapha dosha on my assessment, let's say on my assessment the kapha dosha associated with pitta dosha and vayu, which is 3, my treatment will change. If it is only vayu, my treatment will change. If it is a combination of multiple tissues, that is from rasa, rakta, mamsa till asti, my treatment will change. So there are multiple, so it is not a fixed protocols of yes, of course there is a generalized protocol saying that in hemorrhagic stroke these are the protocols to be done, in ischemic stroke these are the protocols to be done. But one step more deeper would be to assess these informations and then come into an understanding. This will be discussed with the patients and the patient bystander, stating that, look, Mr. Patient, this is, or the patient or the patient bystander, whoever is applicable, stating that this is the problem of your problem, this is what it is there, this is the progression happening, and then this is how I'm planning to get it reversed. So this is being done on one-on-one basis. This cannot be generalized.
right, I hope those who have asked the question have got this answer. Yet another question that we talk about, you were talking about the challenges faced by the patient. So, how does Ayurveda address the mental and emotional well-being of a stroke patient during the recovery process, and of course after that as well?
Correct. That's a good question. See, our interpersonal relationships are formed, from the very first day of patient's assessment. We actually at Ayurveda, we comprehend the patient's full health cycle through a comprehensive assessment pattern. And the treatment plan will includes addressing their physical, the emotional, the mental supports, what the patient is required at that point of time for their recovery. And that every phases, we not only ensure that the patient's support care is emphasized, but also the patient's family support is also, because they also undergo very bad traumatic phase. They also undergo a very bad phase of and help, or pray that they come back to normalcy. So we understand that aspect as well, and then ensure that the patient's family is also supported through understanding the disease progression, what outcomes can be expected, what is the plan, or what are the strategies of the treatment. On discussion to them, they are at ease. So this is how we ensure that both patients recovery and patients well-being and patients kith and kin emotional well-being is also being taken care.
Yes, thank you for answering that. If there are any more questions, please post it in this Q&A section. We will definitely take it. If there are no questions from the audience, then I would like to ask one final question. Just in your opinion, Dr. Rakesh, what is the biggest misconception or misunderstanding that people have about Ayurveda in its, role of stroke recovery? And there are many multiple myths around Ayurveda and its clinical application. So how do you address it? What would you like to say to our participants and everyone as such?
So, yeah, I would take it in two phases. The first phase is uh, on medications. So everybody, all patients thinks that Ayurveda medicines just intake your that is a rehabilitation. No, Ayurveda medicines forms a part of the rehabilitation services. If his gut is not strengthened, whatever medicine I give will not be absorbed with respect to strokes. So there is requirement for stabilizing his gut, then improving. So there are step-by-step process for that. So that myth that or misconception that this medicine is for stroke, or say this herb is for the stroke, this immediately given that, no, that is not the correct, that is not the way of rehabilitating, or that's not the way of treating strokes. Second would be, is the Ayurveda medicine safe, which is a $1 million questions. I would say that there are legal bodies to check the quality of the medicines, but more than that, it is the skill of the physicians to give the medicines at appropriate time, if and if required. We usually do not give in initial phases. We only target it on first on the external basis, medicine basis, and external treatment, and it's only at the end only we give the internal medicines as a part of Brahman or Rasayana. So initial phases. So because we don't have any data on the drug to drug interactions. So however, keeping that as a question also, probably almost all Ayurveda medicines are safe. Number one. Number two is, what stage are they supposed to be proposed to be given? Which medicine to be given at which phases? That is the crucial assessment. So these are two things which needs to be done. One is the medicine. Ayurveda is not only medicine based. It's medicine is a part of the whole journey of treatment.
So there's another question that just one second, sir. Sir, can you stop sharing your screen? It is looking like two screens in one.
Oh yeah, okay. Yeah. Done.
Yes. All right. Sir, another last two questions we have. One of them is whether allopathic doctors also talk about integrative therapy or only Ayurveda doctors are talking about this.
Wow, very good question. Stroke recovery, is a actually a complex journey. It's a very complex journey. It is like we are rebooting the software control, like which controls both our physical and the physiological process. An integrative approach is, the aim is to accelerate the recovery, that is to faster the recovery, which is actually catching up with global recognition. Worldwide, there's a global recognition. Some of our the pioneering works which we do in our hospitals, we work with stroke patients, are actually in consultation with the field of neurosciences, neurosurgery, the PMRs, consultants. We are working closely with them, and they have also recognized that the value addition what we give in the form of Ayurveda treatments, Ayurveda principles, which is enhancing the outcomes and patients recovery. So it is slowly accepting, but yes, of course, this integrative care is obviously done with closely working with the senior consultants.
I hope the you were answered satisfactorily. There's another question. can we not treat patients of Pakshaghata independently with only Ayurveda, pranayam, and meditation? Sorry.
Firstly, depends on the nature of the stroke. Secondly, it depends on the residual symptoms post stroke recovery. What is the status? Thirdly, it is on the patient's bala, the rogi bala, what we call it as vyadikshamatvam or samhananam, and his bala to how fast this gets back. Only with pranayama or yoga is a tool to use to all kind of pakshagata patients. It's like I have multiple, I want to prepare some dishes. With only one dish, with one thing, I can't prepare. I need spoons, I need forks, I need multiple things to make it a good dish. Like that, yoga, pranayama are one of the tools. Where do you put that for the patient's recovery is the skill Vaidya's choice. You can put it in the front, start of the treatment. You can put it in the center, or you can put it post. Definitely. But only with that, I have not tried. I cannot comment on that. But it helps in complementing the rehabilitation.
All right. There's another question from Dr. Chavi. Whether all Ayurvedic drugs advised and action along with allopathic medicine have safety and toxicity checked?
There is a minimal study on that, a drug to drug interaction. We have no idea what is a drug to drug interaction. We have no evidences, we have no proper data collection on what is happening. So on the safer side, because there are some studies on some drugs and some active principles, but as a this one as a combination of ours, as a formulation of our own, we have complex medicines, we have multiple medicines, and with this one it's very difficult to do the tests. So there's scientifically speaking, there is no evidences on drug to drug interactions. It is for this reason that our approach of integrative approach would be first externally, and of course the kriyas and the therapies are also external therapies. Then on one point of time only we go with internal medications.
All right. If there are no more questions from the audience, uh, we can conclude the session by asking, I'm going to ask you only 3 tips to prevent strokes. And for, I'm sure at least one person we know in our life who has been through stroke, who has got, has this accident, or that we see that, it is very common. It's not that everyone in our family or friends we know we have, but we know one person at least. So to prevent such further episodes, accidents, what are the 3 lifestyle tips, Ayurveda tips that you would like to share on World Stroke Day?
Okay, first thing is habits, tobaccos, alcohol, teas, coffees in a minimal quantities, not spurious usage or over consumptions. Habits needs to have a check. Second, our lifestyle. Lifestyle means what is your day routine from the time you wake up till you sleep. What is your routine? Is it completely sedentary? No, our body is not meant to be sedentary. Our body is meant to be moving. It has to be locomotions. It has to move. So what are we doing to get that happen? We in Ayurveda, we call it as Vyayamam. But Vyayamam need not be exercises. It could be our lifestyle. From the time we get up, what are the activities we do? Then, third one, the mental part. What are we doing for our mental? Just like our physical body, we have a mental body. So, what are we doing to get that mental strength? Fourth is our food habits. Food habits plays a major role. See, there are cheats, there are cheat days. We can all involve in cheat days, but daily cheat days is not the answer. We have to assess our digestive system. We should see how much we can digest. Based on that, we have to have our food. It's like I have no digestion, no slow digestion capacity, and I want to have a good amount of masala food items, or the fast foods and junk foods. It's not possible. It's not going to. That's the where the dysbiosis creates, or that intestinal strength reduces. So what do we eat? That is very important. Stay as light as possible, improve your endurance, physical stamina endurance, and finally have your health checks done regularly on a yearly basis. It gives us an understanding that how is your data, because all signs and symptoms are not given physically. Sometimes some ischemic strokes, as one question was asked on ischemic and hemorrhagic stroke, some ischemic strokes are just onset, sudden onset. We don't know when it will happen. But if we are doing a systemic yearly health checks, we can come to know that, yeah, I am having the risk, I am having the probability of having this. So I can start preventing from my food, from my lifestyle habits, and things like that. So yearly checkups of your health is very much mandatory. What is hidden will be coming out. I mean, hidden means whatever the hidden is coming out through the blood test and the scans, which is mandatory after a particular age, say post 45, 50s, it is mandatory. This is my simple tips. If you do this, it is preventable.
Thank you. Thank you for sharing that, Dr. Rakesh. It really is important, and these tips are really very essential since all of us are, having a very sedentary or not that active lifestyle. So these tips definitely will help everyone, and we can, of course, pass it on to our friends and family, so they can also get the advantage of being healthy and getting their whole body checked yearly.
Thank
So
you.
this was really helpful, Dr. Rakesh, and thank you once again for this insightful session. And on World Stroke Day, you have made an impact and created awareness about stroke, which really is the need of the hour. And thank you one more time for giving us your time, your knowledge, and your session. Thank you.
Thank you. Thank you. Thank you. Yes.
And all those who have attended and have got any questions, any personal queries, they can definitely reach out to us, and you can have one on one session with Dr. Rakesh. Thank you everyone for joining in.